Hello, and welcome to Thoughtful Thursday, a space to pause, reflect, and explore ideas that matter. I'm glad you're here. Today's episode takes us into the heart of something both overdue and deeply important, a national step forward in how the UK's healthcare system serves its LGBT+ population. This week, the NHS launched its first ever in-depth review aimed at tackling the health inequalities experienced by LGBT+ people. It's a significant move, one that acknowledges what many have known and lived for a long time, that healthcare hasn't always been a safe or equal place for everyone. Too many LGBT+ people have faced real barriers in getting the care they need not just once or twice, but systemically. The 2018 National LGBT Survey showed troubling trends: widespread dissatisfaction with mental health services, a lack of trust in GPS, and stories of being misunderstood, overlooked, or even mistreated in clinical settings. It's not just about poor experiences. These inequalities lead to poorer health outcomes, shorter lives, and deep mistrust in systems meant to protect and heal. That's why this NHS review matters. It's not performative. It's not symbolic. It's investigative, collaborative, and potentially transformational. Led by Dr. Michael Brady, the National Advisor for LGBT Health at NHS England, the 6-month project will explore how the NHS can better meet the needs of LGBT+ patients across everything from mental health and primary care, to cancer screening, HIV prevention, perinatal care, and substance use services. This is about more than mapping problems, it's about understanding why they persist, and identifying what's working. Because there are places and practices that have made strides, and those need to be amplified. The review is rooted in evidence, but also in listening. That's why the NHS is asking academics, clinicians, community organisations, and local authorities to contribute data, stories, and insight. It's a chance for people who've been working in the margins of health equity to be heard, and to shape something better. It's also aligned with the NHS's 10-year health plan, especially its focus on shifting care from hospitals to communities, from reactive treatment to prevention, and from outdated systems to inclusive digital care. Each of those shifts, if done intentionally, can help dismantle the structural barriers LGBT+ people face when navigating the health system. As Dr. Brady put it, it's unacceptable that LGBT+ people have a poorer overall experience of health services, which leads to worse health outcomes. And Health Secretary Wes Streeting echoed this, saying the NHS is at its best when it serves everyone equally, and that right now, that simply isn't happening. There's a lot of work ahead. Reviews alone don't fix systems. But this is a step toward acknowledging past harm and reimagining the future. Because true dignity in healthcare means more than a diagnosis or prescription, it means being seen, respected, and treated with the humanity every person deserves, no matter their identity. As we move through the rest of this Thursday, I hope you'll hold on to that idea that better healthcare for LGBT+ people isn't a niche concern. It's a matter of justice. It's about building a society where trust is possible, and healing isn't conditional. Thanks for joining me today. I'm Kirsty, and this has been Thoughtful Thursday. Take care of yourself, and take care of one another.